I think we're going to get started. We really want to welcome you all this afternoon to this webinar, which we are sponsoring with Podometrics. Again, my name is Gary Rothenberg. I'm a podiatrist. I'm also the Director of Medical Affairs for Podometrics. And we are excited to have you all with us this afternoon to talk about the importance of shoes and inserts, especially in managing your diabetic foot health. So this is our second webinar. We're really excited to have many of you back, hopefully. And there are several others that are coming up on a monthly basis. So we encourage you to sign up for those as well. Sorry, I'm going to go back just to these kind of housekeeping notes before we start. We are recording this, and we will have the recording available at a later date. Hopefully that is going to be put on our website, but we are recording this just so that you all are aware of that. We also encourage you to ask questions, and we'll get to those at the end of the presentation. There should be a Q&A little icon at the bottom of your screen or on that black bar through Zoom. We encourage you to put your questions in the Q&A, and along with my colleagues who are running this webinar, if it's something that they can answer logistically, we will answer those along the way. If it's something clinical and it's for me, I will answer those at the end of my presentation. We'll do those questions at the very end. We do know that sometimes technical difficulties happen, and if you're having volume issues, try increasing the volume. But if all else fails, try leaving the webinar and rejoining. Sometimes we see that is helpful as well. So again, we appreciate your time this afternoon, and hopefully you'll learn something about shoes and inserts, and again, to maintain overall good foot health. So we'll get started. Really wanted to, again, review today the importance of checking your feet on a routine basis for overall good foot health. We'll then talk about the benefits of proper footwear, and I'm going to give you some specific recommendations that I have for managing patients with diabetes for the past 25 years. And then also, I will share with you up front, I actually get more concerned or more uptight about inserts than I do about shoes. Many times my patients will hear me refer to shoes are actually just a container for the insert. And it's that insert that really should be unique for every person, because that's the contact or the interface between your foot and the world. And again, if you can fit my kind of custom recommended insert into any type shoe, typically that is perfectly fine with me. So we do know that proper footwear and inserts are really a very, very important part of maintaining foot health. And I'm going to show you some studies and some statistics around the fact that a lot of foot problems actually can begin with shoes, and specifically the wrong pair of shoes. That might not fit like they did before, or they feel great when you're walking around in the store, but they end up then causing problems for people living with diabetes. So that's just a general introduction and overview, but hopefully we'll spend the next 30, 40 minutes or so giving you some good examples and good pearls around choosing good shoes and inserts and the importance of wearing shoes all the time. So just again, some general overall kind of themes that I like to share with my audiences and patients, whether they're in my clinic or on a Zoom call like this one. Really, we know that there are significant ways that diabetes can have effect on feet. Mostly that's through the development of neuropathy or nerve damage, which results in reduced sensation or reduced feeling. And because of neuropathy and the lack of feeling, again, a pair of shoes that may be too snug or are rubbing a blister, they can cause problems. People with neuropathy don't have that feedback that there's irritation or that the shoe, in fact, is too small. We also know that people with diabetes tend to develop peripheral arterial disease, or more commonly known as poor circulation. And this can be a reason why wounds develop or wounds struggle to heal among people living with diabetes. And then, of course, because of the potential for open wounds that are caused by reduced sensation and affected by poor circulation, people with diabetes are at increased risks for infections. And that's what we're really at Podometrics very much about preventing, is preventing diabetic foot ulcers or open sores, and making sure that if you have had a history of an open sore or a wound, that we can do things to help prevent those problems from coming back or reoccurring. And again, temperature monitoring, like we do with the smart mat, or even the role of shoes and inserts, checking your feet every day, all of those are really important strategies to help prevent complications associated with diabetes. So, just in terms of some definitions, common foot problems, foot ulcers, an ulcer, most people understand or have heard the word ulcer is related to your stomach. And most people know that an ulcer in your stomach is actually where the lining of your GI system actually has a hole in it. And we call ulcers of the foot essentially open sores or a hole in the bottom of the foot. And those generally come from pressure, and from foot deformities or bunions or hammer toes, things that we talked about in the last webinar. But we know that these open wounds, they represent a portal of entry or an opening between the outside world and the inside world. And so bugs and bacteria can get in those wounds and cause infections. And typically, corns and calluses, and semantically, or when we talk about definitions, a corn is on the top of the foot, like on the top of a toe, and a callus is on the bottom of the foot. They're both kind of collection of dead skin that results, again, typically from increased pressure. And prevention is what, again, we're all about at Plutometrics, is giving you ways and helping you to reduce the risk of these infections and complications, which unfortunately can result in amputations. So we know that good prevention can really result in better outcomes. Like I always kind of say, we in the diabetes world, we hear, oh, diabetes is the leading cause of kidney disease, or diabetes is the leading cause of blindness. Diabetes is the leading cause of amputation. Well, we also know that when you manage your diabetes really well, diabetes can be the leading cause of nothing. We want to make sure that you do the preventive strategies, especially at Podometrics. We're so focused on good foot care, and because we know so many people are at risk for developing the complications, as I mentioned, of neuropathy, of infections, of open sores and ulcers. But we're here to give you some tools to help you outsmart diabetes. And that really does start with checking your feet every day, doing a good exam. And I recommend for most people to touch their feet every day. We know some people with diabetes also have problems seeing the bottom of their foot. I think anybody, it's a challenge to see the bottom of your foot, even if you're young, healthy, and thin. But many of us who are older and not so thin, and I'll include myself in that category as well, it's tough to see the bottom of your foot. So we want to make sure that you have other tools. And usually, again, I recommend touching your feet, whether that is crossing your legs and looking at them as best you can, or touching them to see if there's any bumps or irregularities or drainage or anything that you didn't notice the day before. And typically, I mentioned in the last webinar last month, I really recommend that a lot of my patients utilize cream or lotion on their feet every day so that they can, again, make sure that they're touching their feet, preventing dry skin, and of course, always having appropriate follow-up with your foot care specialist. Usually that's your podiatrist. So we'll move on. And here's what I alluded to earlier. I wanted to share with you a study which actually showed when wounds occur in people with diabetes, there's a big percentage of them that kind of happen by bumps in the night. Those minor injuries, things that we don't see or think much of, like stubbing your toe, walking to the restroom in the middle of the night. But we also know that about 36% of wounds, so over a third of wounds in people with diabetes, are actually shoe-related issues. So we're going to talk about this, but feet do change shape over the course of our lives. We have changes in the shape and the width. So the idea that you might not be the same exact size of shoe as when you graduated high school a few years ago may make a difference. And I'm going to make the case for getting evaluated and measured for good shoes on a routine and regular basis, and not just make the assumption that you're still a size 10 or you're still a size, have a regular width that's necessary as well. When we talk about risk factors, I've talked about some of these. These are the reasons why people develop wounds. And at the top of that list is neuropathy, as well as peripheral arterial disease, which again is the lack of feeling as well as the poor circulation. But deformity and trauma are really major contributing factors where shoes play a role. So again, if you have had, unfortunately, part of a toe removed, that results in a foot deformity. Maybe you have a hammer toe that sticks up very prominently, or a bunion that is also a source of foot deformity. And then I included trauma here because trauma doesn't have to be something heavy dropping on your foot. Trauma can be the everyday wear and tear from shoes, especially over one of those bony prominences or foot deformity that can really lead to problems. We also know that people develop wounds based on the duration of diabetes as well as a previous history of ulcer or wound. So those risk factors that put people at risk for developing wounds, many times after that wound is healed, they still have those same risk factors, the neuropathy, the poor circulation, the diabetes that has been in our lives for many, many years. So again, just painting the picture here, really that shoes and inserts play a role in causing problems, but I'm going to also make the case how they play a role in preventing problems as well. So this is an example. It's kind of a cartoon outline here, but this is one of the things that I will often do with my patients. And I'll explain to you what's going on here. On the left side of the screen, you can actually see this cartoon of a person literally kind of almost pretending like they're in kindergarten and taking a piece of paper, putting your shoe on it and tracing that outline. What I will do sometimes when a patient comes in and I clearly know that they are in a pair of shoes that's too small or too narrow, will actually have them do this exercise, trace their foot onto a piece of paper. And then what I do is I put the actual shoe that they're trying to use over top of that outline tracing. And many times you will see that the foot outline really overlaps or is much wider than the actual shoe outline here. So that's kind of what I'm trying to demonstrate. And it's a kind of a visual exercise that I do with my patients to show them, hey, you're trying to fit into a shoe that does not match your foot shape. And obviously, if you're trying to cram into a foot or a foot that's more wide into a shoe that's too narrow, that's a potential area of problem. So you can see here on the right, where obviously the outline of the shoe kind of matches the outline of the foot. So again, just kind of almost some people are visual people and they respond to and understand, okay, I see how my foot is really getting crammed into a shoe that's too small. So you may want to try that at home to outline your foot and then see if you put the shoe on top, does it seem to match? Again, a visual way of identifying shoes that might be too small and that you might have to get rid of. So we'll talk about the importance of proper footwear, and what you see on the slide there are some examples of what we call depth inlay shoes, or these are tend to also be called diabetic shoes. And there's been an evolution of these type shoes over the years. Many of them look like athletic style shoes or trail shoes. They can be even slightly dressy, like the nice one that we see in the bottom center there. So there's been this evolution, and they're not the ugly, heavy diabetic shoes of 25 or 30 years ago. We've definitely made some advances in even the aesthetics or the look of diabetic shoes. So we'll talk about that, but shoes obviously have a very important role in preventing injuries. Obviously, again, bumps in the night happen, and typically that's because we're not wearing shoes. Or injuries can happen where you step on something, and the likelihood that there will be a bad outcome is less if you're wearing shoes because of the physical barrier. and the protection that shoes will provide. We also know that shoes will help in supporting foot mechanics or ability to stay upright, to stay balanced, and to really walk appropriately through the normal gait cycle. So many times, feet that are barefoot have to work much harder to maintain balance than actually when you are in shoes, which, as I tend to say, the goal of diabetic shoes and inserts is not to allow your foot to collapse to the floor, but to bring the floor up to your foot and put you in a normal anatomic position so that you don't have to work harder in that walking cycle. We also know that shoes and inserts really need to accommodate special types of feet and foot problems like calluses. So if I know that one of my patients has had problems with a wound to their pinky toe, their small toe, is there a modification that I can make to the shoe or the insert which would help avoid that pressure um, and potential for infection by shoes and irritation from walking? And that is our goal because we know that people and maintaining their ambulatory status, ability to walk is really tied with quality of life. So we want to keep people active and healthy, and really shoes and inserts are a very significant and important part of that process. So I'm not, this is a busy slide, but I just wanted to kind of put out here that there are different definitions that we give to certain types of shoes, but essentially all of these are very, very similar. What are referred to as diabetic shoes, orthopedic shoes, those essentially are the same type of shoes. And they tend to be a little bit deeper and a little bit wider to especially accommodate the inserts. And as I mentioned, I get more uptight about the inserts than I do about the shoes themselves. Now, custom made shoes is where actually a cobbler or shoemaker actually makes a mold of somebody's foot and builds a shoe around that mold. Those are generally only required for patients who have very significant foot deformities. Most of the time today, we can accommodate people's um, feet with regular or what we would call off the shelf shoes, which again come in various sizes. But for very unique situations, there is the ability to actually build a pair of shoes around people's specific feet. As you can imagine, custom shoes can be very expensive because they're unique to that patient and require a lot more labor to actually build. But off the shelf shoes can be referred to as diabetic shoes or orthopedic shoes. And again, the point here is that they really are made to accommodate some foot deformity, but really made to make sure that we can put in a custom insert into those shoes to accommodate people's specific issues. Let's talk for a moment about fit of shoes. And of course, we want to make sure that the size is appropriate, that the width is appropriate, and that the length is appropriate. And as I mentioned, people's feet will change shape over time. Both men and women experience this, that we tend to see that feet get actually do lengthen and they actually widen over time. It's less common for people's feet to get smaller. It is more common for people's feet to get bigger over time. We also recommend, it's my personal recommendation, that when you are in a shoe store, for example, and you might have issues with swelling that come on intermittently from time to time, it's generally best to actually do your shoe shopping in the afternoon or the evening, because we tend to see that as people who have swelling issues wake up in the morning, they're less swollen. And as the day goes on, they have more swelling. So if you're going to fit yourself or go to a shoe store where you are fit, it is generally recommended to do that in the afternoon or evening because you want to get sized for when your feet are actually a little bit swollen if you do have some swelling. so that you don't get them too small and that they become too tight as the day goes along. Again, another area which I think there's been an increase in availability and options is actually in widths of shoes. And it used to be a real challenge that you had to go to a specialty shoe store. We're going to talk about some specific brands of shoes, but I think a lot of the off the shelf shoe companies are doing a little better job in really giving those people who have wider feet a better option for different types of wider width shoes. So again, it's really a good idea to get measured and going to a local or a family-run shoe store. I'm actually zooming in from Ann Arbor, Michigan today. We have a wonderful family-owned shoe store here in town where I send many of my patients to. I would caution, again, some of the shoe stores where you end up going in and measuring yourself. But if in your community you have a shoe store where they use that old device, like when we were kids, where you step on it and they actually measure based on length and width, every now and again, it's a good idea to get measured. Many of you may go to the VA hospitals around the country, and they may, in their prosthetics department, utilize those devices to actually help you get measured for shoes. And you may be surprised, again, that you used to always be a 10 regular and now you're an 11 wide measuring it, your foot. So again, it is common that things will change over time. There's that old kind of way of measuring shoes to make sure that you have a thumb width of length available at the end of your shoe, between the end of your toe and the end of the shoe. And we still kind of subscribe to that recommendation at this time. So again, making sure that the size, the width, and the length are all appropriate, and getting help if there's somebody in your community, again, at a good shoe store, to make sure that you're getting measured properly is a good recommendation. So let's talk about the materials, the cushioning, and the sole of the shoe. Many times we're recommending a breathable material. Oftentimes, a mesh-like material is really helpful for people with diabetes. And I like those because they're breathable and they're not so hard. They don't require as much break-in typically as a more rigid leather material. So we also know that when the shoe can breathe, there's reduced risk for things to get in to develop like fungal infections. So generally, again, if you have more of a foot deformity, a softer material, a mesh style material is recommended. The cushioning, my favorite types of shoes for people with diabetes are actually running shoes. You may not be a runner, but running shoes tend to have a lot of cushion and shock absorption because runners generally need that. So whether you're walking or you're running, I really like running shoes because they have that additional shock absorption and cushion. We also know that some people have more flat feet or more high arches, and there are definitely specific recommendations. And if you see your foot care specialist, your podiatrist, they may have specific recommendations on your foot type. But in general, there are some that will just accommodate more of a flat foot. And what I see is that people with very flat feet tend not to like shoes that have more of an arch in them because it feels like they're walking on a lump in their arch. Whereas if you have a very high arch, some people feel like the shoe doesn't contact their foot very well. So this is where, again, we're going to talk about inserts. Nice thick soles, and make a point about slippers and house shoes. Again, it's my recommendation to absolutely wear shoes all the time. That means inside of the house and outside of the house. And we generally like something, even in a house shoe or a slipper, that has a nice firm sole to it. Provides more support. It also is more protection against stepping on things like, insulin needles or carpet tacks that come loose. So we want to make sure that the sole is very, very solid and firm. Also important would be non-slip soles, so that those are obviously advantageous to prevent slips and falls. So those are some characteristics that I really recommend and hopefully make some sense to you all. People ask me all the time about specific shoe recommendations, and these are general recommendations. If you love shoes and the name brand is not on this slide, but you know that that shoe fits you very, very well, then go for it. I recommend these are recommendations when people have trouble finding shoes that are comfortable and that tend to fit their feet. These are some of the name brands that I recommend. For example, there are some that are athletic shoes like New Balance, Brooks, Skechers. Those tend to be more of an athletic style, and I like them because they tend to come in widths and they tend to be a little bit deeper. So, again, many of my patients end up with inserts and shoes from me, but I'm realistic. I understand that people don't want to only wear the one pair of shoes that the VA, for example, or that Medicare pays for. We'll talk about that in a second. But it's the insert. If they can get that additional insert or move the insert from the diabetic shoe into, for example, a New Balance shoe, that's okay with me. And I like that people tend to want to wear shoes that they like. They'll be more apt to wear them. But it's that insert that I think is the key in moving from your diabetic shoes or having the additional insert to wear in, for example, an SAS shoe. Many those are been around for years and years. Many of the true diabetic shoes, for example, again, that the VA dispenses, they're generally by a company either called Dr. Comfort or ProPay. Those are very common, or Atrex. Those are very, very common. So oftentimes those are available as well in shoe stores or online. So if you need an additional parent and you're able to purchase those, sometimes that's a really good option, is to get the one pair, for example, from the VA and then replace them as you need them, or additional pairs if you want them in different colors, for example, as well. But what all of these shoe companies and these specific brands have in common is that they tend to be extra depth or a little bit deeper. They tend to come in widths, and they also provide various options for closure. So, meaning sometimes laces are not convenient or not easy. So, they may have Velcro closures. And the idea that they will come with an insert, but that they have the option for a removable insert that you can then put in the one that's prescribed by your healthcare provider. So again, always check for fit and comfort. We've all been kind of deceived. I know I have. The shoes feel really comfortable as you walk around in the store, but then you bring them home and they somehow cause problems. And many shoe stores, you may know this, but many shoe stores will allow you to return shoes unless you've worn them outside. So don't, I really recommend doing some walk testing and break in shoes, but that you do that in your home so that there's no obvious wear from outdoor use. And so that's really important to make sure that the shoes are as comfortable as they felt in the store when you actually wear them for a little bit more of an extended period of time. We also recommend checking your shoes frequently. I know in my house and many of my patients, you leave your regular shoes at the door and then you switch right into your house shoes, whether that be right at the entry to your front door or the garage. And you know what? Sometimes things can end up in those shoes. Whether you live in the Southwest and you could end up with something like a scorpion in your shoe, and I've seen that before, or grandkids come over and they play and a Lego ends up inside somebody's shoe. I've seen that too. So we always recommend that you're checking the insides of your shoes before you put them on, but there can also be clues that are helpful to you and your doctor about the way that you wear shoes. Where are they worn down? Is it more on the inside, more on the outside? When we pull out that insert, is there a little well or an indentation that might indicate a pressure point? That can be really, really helpful. So both you and your provider should be looking at the wear and tear of the shoe as well. And of course, making sure that they stay in good shape according to how the manufacturer recommends that you actually take care of them. Many shoes don't do well when you put them in the washing machine, right? So just taking a simple dry, wet cloth, a wet cloth and then a dry one to clean them off. Because oftentimes, again, putting shoes in the washer and the dryer can change the shape or actually disrupt the kind of physical structure of the shoe itself. So it's generally not recommended to put your shoes and the inserts into a washer and dryer. So let's focus for a few minutes on inserts or orthotics. Inserts are generally a term that most people are familiar with. The medical term for an insert is an orthotic. Many people who have foot problems, even athletes or runners, they will use orthotics to make sure that their feet are appropriately supported and that if there are any issues, that the orthotic can help in the actual process of keeping them active and healthy. Usually in people with diabetes, we tend to use some firm yet soft materials. They could be cork or a very dense foam. And usually in my practice, I'm recommending what's called a tri-laminar insert. Tri referring to 3 layers. And the softest layer is always up against the foot. Then we have a medium density layer that I sandwich in. And then the bottom layer, while still soft and flexible, has a more firm density to it to maintain the shape and make sure, as again, I think you can see in that kind of demonstration on the slide, the idea is we want to bring the floor up to the foot and not allow the foot to collapse down to the floor. So we categorize inserts or orthotics into 2 main categories, functional or accommodative. Functional orthotics generally, again, are used for people with more sports medicine related issues, are athletes and runners, and they tend to be even harder or more firm than the accommodative inserts, which are generally the types of inserts that I recommend, that most people recommend for people with diabetes, that are a little bit more soft and can make sure that we can mold them to the foot and accommodate for any special deformities that people have. Now, again, most of the time, I like a custom molded orthotic where we actually make an impression of your foot. That can be done in various ways. The most common way is probably having people step into a foam box, which creates an imprint of your foot within that foam box. And then from that, actually, what's called a negative cast, they actually fill that with plaster and create a mold, which essentially represents your foot. And then from that mold, the orthotics people and prosthetics people will then fabricate the insert itself. And again, I reviewed this. I typically make them a tri-laminar insert. And we want to make sure that they will accommodate for any calluses or other issues. Another common way of doing it for people with less complicated feet tend to be that we start off with what's called a prefab or generally a very good insert. And then the provider may heat mold that, literally take a hair dryer or put it in the microwave for a few minutes, and then take that heated insert, prefabricated insert, and put that up to the patient's foot to actually make some tweaks and modifications and make it unique for that person. So that's a very common and viable way, is to start off with a prefabricated orthotic. Or if the deformity is more significant, patients may end up with a custom molded insert as well. So these are some of the ways that we and things that we make bells and whistles or accommodations onto specific inserts. This one, sorry, appearing a little bit fuzzy on my screen, but if a patient has a callus, then we can make a build around the callus itself. This is the bottom of the orthotic. This might be for somebody who has heel pain, where this is really soft. And it's almost like the callus or the heel pain can be accommodated by sinking into a little valley. Some people who have more issues at the front part of their foot, we put what's called a metatarsal pad in there. And that helps relieve some of the pressure off the front part of the foot. If unfortunately patients have undergone partial foot amputations or removal of all of their toes, we tend to put a dense foam filler where those toes were to actually help with balance issues. So we keep your foot the same size, right and left, but we put in a dense foam filler where the toes used to be. That's why, again, I get very uptight and more concerned about the insert for, especially for people who've already had foot problems. It's what can I do between for the interface between your foot and the world to really protect it. And these are some of the special modifications that we can make. So I want to briefly talk about the therapeutic shoe bill. Lots of people, this goes back a long, long time now, many, many years, and people literally had to lobby to Congress for paying for Medicare or CMS to pay for shoes and inserts for people with diabetes who are at risk for foot problems. And again, this program has been going on now for 30 plus years. And we want to make sure that people take advantage of this because people have Medicare and specifically Part B of Medicare. This is one of the few preventive strategies that Medicare has really signed on for. And in general, everybody's situation or plan may be a bit different, but in general, Medicare will cover 80% of one pair of shoes and 3 sets of inserts per calendar year. So many times, again, many people may be from the VA. These are general guidelines, but also Medicare, if you have Medicare, to take advantage of this is really important and helpful because shoes play such an important role in prevention of foot complications. It does require the prescriber, which is usually a foot doctor. It also requires a certifying provider. And according to Medicare recommendations, that's actually the doctor who's treating you under a comprehensive plan for diabetes. So that may be your primary care doctor, that may be an endocrinologist. And then it requires the supplier. So that's usually the shoe store or the DME, durable medical equipment place where you get your shoes and inserts. So I just wanted to bring this up if anybody was unaware. Medicare generally does pay for shoes. Again, you do have to meet specific criteria, but it's something to take advantage of if you do have this option available to you. The criteria for Medicare to pay for shoes, it's not diabetes alone. You have to have diabetes as well as neuropathy. We talked about that lack of feeling, foot deformities, which put people at risk for wounds if you've had a history of a wound, or again, poor circulation. Coming back to a lot of these risk factors. So I really appreciate that Medicare would rather pay for a pair of shoes and inserts for somebody with diabetes who's at risk to develop a wound than actually pay for the care that's associated with that wound itself. So we'll finish with a couple of my tips for good foot health. If you were on the last one, you may have seen these, but I'm going to reiterate them because I think they're so important. And these are the ways to keep you out of trouble when you, again, have diabetes and are at risk for foot problems. And the number one thing is not going barefoot. And that's where, again, this talk kind of comes full circle that shoes and inserts are really important to wear inside of the house, outside of the house. Certainly not walking outdoors without shoes on. Going to the pool, we recommend wearing shoes up to and maybe even water shoes in the pool. Certainly at the beach where there's shells and things that are rough and sharp, those can cause problems. So not walking barefoot is a really important point to help avoid complications from diabetes as related to your feet. We generally recommend cotton white socks. Cotton because it breathes really well. White socks because if unfortunately a problem does develop during the day and you end up with a blister that maybe drains or has some fluid or you see some bleeding, you would notice that on a white sock as you took it off at the end of the day. Heating pads are generally not recommended, especially for people with neuropathy, because again, we don't want you to get a burn. Cutting corns and calluses and nails on your own is not generally recommended, especially again if you have neuropathy or poor circulation, because we've heard plenty of stories and I've seen in my career people think they're cutting the end of the nail, but they're actually cutting the tip of the toe. And they don't realize it until they see blood. So, again, generally, Medicare, the VA provides what we call routine foot care, which is associated with regular checkups. And if you have had foot problems already, generally the recommendation is at least to be seen by your foot care specialist annually. But most people with diabetes who've had a foot problem before are usually seen somewhere around every 3 to 4 months by their podiatrist for, again, nail care, callus care, and good foot education. That's what your podiatrist is there to do as well, is to reinforce foot education and make sure that we are maintaining your ability to walk and maintain a wound-free life, because we don't want you to have to battle and deal with the issues associated with these outcomes from getting wounds on your feet. If you can't see the bottom of your feet, again, I shared my recommendation for touching them. There's also the option of putting a mirror on the bottom of your foot or on the floor so that you can use the mirror to inspect the bottom of your feet. Soaking, again, is generally not recommended because of the risk of temperatures being too warm of the water, things like that. I mentioned using cream or lotion daily. I don't have a specific recommendation for a foot cream. I always tell my patients, buy the big jar, buy the one that's on sale, keep it by your bedside, use it every night. So it's not what you use, but it's the consistency with which you use a good cream or lotion that will help avoid foot problems. And again, by using cream or lotion on a daily basis, you're actually touching your feet, which is a great way to do your daily foot check. We talked about breaking in new shoes. Do that in your home. Wear them for an hour, take them off, make sure there's no rubbing or irritation or red spots. If you can't see your feet and you are fortunate to have somebody in your home that can also look at your feet for you, that was really, really helpful as you break in new shoes, because as we saw, shoes can be a culprit in causing foot problems. We want you to maintain good exercise. And as I mentioned, check your shoes for objects, especially if you tend to leave them in the garage or somewhere where other folks have access to them, to make sure that there's no objects in there that are unintended that can cause a problem. So again, hopefully I've shared with you a few pearls, that you've gathered some information about how shoes and inserts are very important, and that there are many different types of shoes that are available. And I am really adamant about the inserts. As I said, in my book, shoes tend to be the container to hold the good insert for you. And we want to make sure that you tend to fit them appropriately, get some help from a good shoe store in your town, or from your foot care specialist or the prosthetics people at your local VA, to make sure that you are getting the proper fit and size of shoe, because people's feet do change over time. And again, the Medicare therapeutic shoe bill always reminds me that foot care, it requires a village to take care of people with diabetes. And we want to make sure that, yeah, my area of particular passion is in foot care, but we also know that your risk for eye problems and kidney problems, and your primary care provider and care navigators and nurses and everybody, and even yourself, especially yourself and caregivers, are really, really important people to help maintain good foot health over time. And as I say, I always want my patients to be healthy, productive members of society and keep walking and doing the things that they really enjoy doing on a regular basis. So we have some time for Q&A, and I'm going to ask my colleague Lauren if she's on to help me with the Q&A, if there's any in that have been put in. Or at this
Yes.
time, I invite people to put your questions into the question and answer box.
Yes, we have two questions so far. The first one is, can you comment on the Hoka brand and inserts?
Yeah, thanks for asking that question. I actually really like Hoka's. Hoka's, I should have probably put it on the slide. It's a little bit of a newer brand, but what Hoka's have, which I think a lot of people with diabetes or other foot issues, they have a slight what we call rocker bottom. It's a little bit making kind of a big, you know, issue out of it. It's kind of like being on a teeter totter. Not quite. It's very slight. But what I really like about the Hokas is that they actually force you to kind of roll through the walking cycle. It's not the abrupt heel toe push off, but when you use Hokas correctly, it's a kind of a rolling through the walking cycle. So it is one of the brands that I do like as well. They do come in widths, not quite as wide as, say, New Balance. New Balance can come up to a 4E. Generally, Hokas are in the 2E or width category, but for somebody who has a mildly wide foot, they do accommodate that. So Hokas are a good brand. Thanks for that question.
Okay, thank you. The next one is sort of a comment, sort of a question. Um, they mentioned that the inserts that you have described here seem more comfortable than the ones they currently have. The ones they have not a lot of cushion. Are they able to be copied and built new? They've been told $500 for a pair from Dr. Comfort through the VA. So they're just wondering what are the options?
Yeah, great question too. So I'll go back to again, typically Medicare will give patients, and the VA tends to follow Medicare guidelines. Every VA is different. Every person with Medicare is different. So the guidelines may be unique to your plan or to what your needs are. But in general, the philosophy behind giving people 3 pairs of inserts is that we know that these inserts, which again are cushioning and they are shock absorbing and they're made of a foam material, whether you weigh 90 pounds or a multiple of 90 pounds, they do bottom out with use over time. And the studies and the reason why people generally, the recommendation is for 3 sets of inserts in a year is because they're recommended to change them every 3 to 4 months because that's usually the the lifespan, I should say, of an insert. Some people may get longer out of them, and some people, if you wear them every day and you tend to walk a little bit more hard or heavy, or you walk more over the course of a day than somebody who walks less, you may need a new insert more frequently than every 3 to 4 months. But in general, those are the recommendations. To comment on the specific costs, those are unique to every location. I wouldn't venture to go there, but in general, you need to work with your provider, again, whether it be on the private side or on the VA side, based on what you need, specifically based on your foot type and how frequently you tend to run through. Many of my patients know it's time to change their inserts because they just aren't as comfortable as they used to be. And that just means that they've been bottomed out and that they lose their shock absorption. Yeah,
Okay,
but
thank
great
you.
question.
The next question is this patient has diabetic shoes with Velcro. Their feet turn inward and they have inserts to help with that condition, but they can't wear the inserts because the insert will not allow the Velcro to stay secure.
Yeah, so in that case, I would probably recommend that you go back to wherever you got the shoes, whether again it's through the VA or a pet orthotic or a DME place. I would generally go back, and they can oftentimes troubleshoot with you to make it so that either change the closure on the shoe or do something to accommodate that insert because that insert's really important. And obviously, if the shoe can't stay closed, that's significant.
Okay, thank you. The next question is this patient has severe hammer toes and they are due to receive diabetic shoes. What specifically should they look out for? Because they also get calluses on the bottoms of their toes.
Yeah, appreciate that. So for people with severe hammer toes, that means that their toes tend to be a little bit proud. And I would definitely make what I'd be looking out for is what is the material of the upper of the shoe to make sure. And these are the situations where I like something soft, either a mesh or a neoprene type top cover. neoprene is the same stuff that wetsuits are made out of. And I actually, in one of my photos, had a neoprene upper shoe. I should have pointed that out. But essentially, you want to make sure that the shoe is deep enough, tall enough, and that the upper of the shoe is not a rigid material. And the for the calluses on the bottom of the foot, that's usually the insert will accommodate those.
Okay, and then we have another comment, not necessarily a question, but just to share. This patient's local VA treats them for a nail trim about every 60 days, along with a foot exam to look for other possible problems. The VA also provides this patient with New Balance shoes and inserts. He does get those by stepping into the box of foam, like you mentioned. And then there's two pairs of shoes with inserts every year that he is able to get.
Yeah, that sounds wonderful. You're getting, $1 million care. Love it. That's exactly what we want to see, and that's perfect. And again, everyone's situation is a little bit different. If you're seen a little bit more frequently, it's generally because you've had a problem before, and we want to avoid those problems again. So some people are seen every 2 months, some people are seen every year. And it really sounds like the VA is taking care of you in particular for your good foot health and giving you shoes, which is wonderful. So that's great to hear.
Yeah, so that's all of the questions that we had come in through the Q&A. Just a reminder that this has been recorded, and we will try to get this posted on our website as soon as possible.
That's great. Well, thanks, Lauren. And we really appreciate everybody attending the session this afternoon. And as you can see on the slide, we do have another one scheduled in about a month. And that topic is daily foot care and the importance of that. So we'll go over some of those things at the next one. But really appreciate everybody tuning in, and check out our website for a lot of patient education materials as well. That's podometrics.com. And for those of you that are on the SmartMap program, we really encourage you to scan every day and allow us to help your providers make sure that you're maintaining your good foot health. So we wish you all a wonderful afternoon, rest of your afternoon and evening. And again, thank you for attending. Bye-bye.